Face masks for protection against transmission of COVID-19. Are they effective? Are they safe? Reasons not to expect others to wear them. So we're going to take a brief look at some alternative facts that you're unlikely to come across on the mainstream media, at least not yet. As we'll see, masks do little to reduce the spread of disease, particularly the one we know as COVID-19, at least within the everyday public environment. They simply serve to drive the selfish and perhaps disproportionate fear which inevitably resulted in an unhealthy response, both physically and psychologically. And it gave rise to excessive emotion and false sentiment, which manifested in a sort of pack mentality covered by a thin veneer of virtue signalling, all of which contributed to the so-called mass formation psychosis, which justified the demonizing and bullying of those who questioned the narrative or failed to comply with the mask mandate. As the author Theodore Dalrymple points out, he's actually a consultant psychologist called Anthony Daniels. As he points out in his book, Spoilt Rotten, The Toxic Cult of Sentimentality. Sentimentality is the expression of emotion without judgment. We've seen a lot of that emotion without judgment over the past 3 years. And worryingly, he continues, that it is the progenitor, the godparent, the midwife of brutality. How stark that is, how poignant. History repeating itself, perhaps, if we're not very careful. So are masks effective? Well, let's follow the science, as we're told very frequently these days. Firstly, a meta-analysis of studies, a meta-analysis is basically examining several or many studies or studies available and deriving conclusions from that overall examination. A meta-analysis of studies didn't show a clear reduction in respiratory viral infection with the use of medical and surgical masks during the seasonal influenza epidemic. Next, an examination of more than 150 studies reported that current evidence implies that face masks can be harmful and are largely ineffective. A Danish study suggested there was no statistically significant difference between those who wore masks and those who didn't wear masks when it came to being infected by COVID-19. Another study in relation to mask wearing and SARS-CoV-2 or COVID suggests that masks didn't make a difference to infection levels. And in fact, countries that masked up more, had more COVID deaths. A study published by our own Cambridge University, no less, suggested there's little evidence to support the effectiveness of face masks to reduce the risk of infection. It's important to note that other studies appear, on the surface at least, to provide incontrovertible evidence to a trusting public of the benefits of masks, but by critical examination of such things as funding, method, context, data collection and analysis, they're sometimes found to be lacking. And while not false, may only be, as Professor John Ioannidis points out, accurate measures of the prevailing bias. Studies like those I've mentioned here, which demonstrate lack of effectiveness and safety, are commonly ignored or disingenuously criticised. So then, if masks aren't as effective as we're led to believe, we have to then ask, are they safe? Well, let's have a look at that. Let's, as we've been told before, previously on several occasions, follow the science. Kieselinski and researchers examined 44 experimental studies and 65 publications, and the researchers revealed psychological and physical deterioration in mask wearers. You can see examples of this in the diagram on the right there. Mask-related changes, the researchers tell us, in respiratory physiology adversely affect blood gases subclinically, and in some cases clinically. Now this has a negative effect on organ systems and metabolic processes with physical, psychological and social consequences for the wearer. Now, although some have argued that mask wearing has little or no effect on ventilation, you'd have to be totally credulous to the point of stupidity or cognitive decline to accept such a proposal. ALGHADIR and researchers clearly demonstrated the strong adverse effects of the face veil on ventilator function among females. Face veils, whose material and fitting are nowhere near as restrictive with regard to air starvation and gas exchange as modern masks worn for protection against COVID. So let's take a brief look at some of these vitally relevant adverse effects found in this research. They report an increase in dead space volume. This is basically the volume of air in the airways that's not available for gas exchange. An increase in dead space volume effectively reduces available air for surface respiration or gas exchange in the lungs. A gas exchange, surface respiration, is basically once the air gets into the base of the lungs, those structures there, the oxygen can pass through into the blood to be taken to tissues, and it can pass from tissues into the blood. It can pass out into the air and be breathed out. They report an increase in breathing resistance. Breathing resistance, put simply, is the effort of breathing in relation to the volume of air breathed. Effectively, what that means is oxygen uptake and carbon dioxide elimination were reduced by increased breathing resistance. Again, to put simply, the muscles are working harder to breathe less air. Increase in blood carbon dioxide. This occurs due to the reasons I previously mentioned, and also, by the way, to the impaired exhalation due to the resistance caused by the mask. In other words, the mask is resisting the movement of air out as you breathe out, and some of it remains within the mask, between the mask and the face, and you will rebreathe it, consequently rebreathing carbon dioxide. They report a decrease in oxygen saturation. This is the amount of oxygen that can be taken up by red blood cells as they pass through the lungs for the consequent transport and delivery to the tissues. The purpose of this, of course, oxygen is in the chemical process that produces energy in our cells. Low oxygen in the blood is known as hypoxemia. This means less oxygen, therefore, is available for cells, which is this, and this is known as hypoxia. Hypoxia is especially important with regard to brain cell function. They report increased heart rate. Of course, this occurs because of the previous previous effects. You know, you have reduced oxygen, the body will cause the heart rate to increase in order to get more blood around the body that contains less oxygen, which means you get a little bit more oxygen as a result of that increased heart rate. It's the exact same thing that happens during exercise. Only in this case, it's a result of mask wearing, even more so perhaps when you're wearing a mask and doing activity. This increase in heart rate is a problem, because the upshot of it is there's an increased workload for the heart and the potential for heart disease to develop, and especially if you have inflammation of the heart following the mRNA shots. They report a decrease in cardiopulmonary capacity, a reduced ability for the coordination of the heart and lungs to deliver optimal levels of oxygen to muscles for energy production and for the removal of waste product, in particular carbon dioxide. Feeling of exhaustion. Well, if you don't have sufficient oxygen, then your cells are not going to be able to make the energy, particularly your brain cells. And so your muscles and brain cells, you're just going to feel exhausted, just like when you've been running. Only in this case, it's because of wearing a mask and perhaps your normal daily activities. Increase in respiratory rate. Well, the body has mechanisms that are called homeostatic mechanisms, and this is what causes the increase in heart rate. But as a result of the reduction in oxygen, your respiratory rate is going to increase. Difficulty breathing and shortness of breath. Well, if your respiratory rate is increasing and you have a mask on which is already inhibiting the inhalation and exhalation of air, you're going to have difficulty, or at least the feeling of difficulty of breathing due to air starvation. And the shortness of breath is the feeling that you can't breathe enough air in to satisfy your body's needs. Of course, that's the case. If you put your hand over somebody's mouth, you will basically be suffocating them. Why would anybody think that a mask, which is not the same as a hand over somebody's mouth and nose, why would you think that that doesn't have an effect? Of course it does. You'd have to be, as I mentioned before, stupid to not realize that. Headache. Well, if your heart rate increases, your blood pressure increases. This causes swelling of the blood vessels, the enlarging of the blood vessels, particularly those that are supplying the brain, because the brain really needs that oxygen quickly to get rid of that carbon dioxide. Now, the skull has no room that holds the brain. It has no room for expansion. The brain cannot expand to any great degree. So anything which swells up in the brain substance is going to cause swelling and pressure on the pain-sensitive nerves of the brain within the meninges. So, of course, you're going to have a headache. Dizziness. Well, again, you're not supplying sufficient oxygen to the brain. Your cells cannot produce energy. The cells won't work properly. You also have an increase in carbon dioxide that causes the chemical changes in the body that causes the cells not to work properly. And within the brain, there's structures that cause us to be able to sense where we are in our environment, and they go awry, and you're going to start feeling dizzy. Of course you are. Feeling of dampness and heat. Well, a researcher researchers, Roberge et al. Found that face masks negatively impact respiratory and skin mechanisms of thermoregulation. That's basically the way the body controls its temperature. And this in turn would have a homeostatic effect, resulting in increased heart rate, breathing rate, and sweating, and so on. So dampness and heat is the increase in temperature, and the dampness is a result of the excess sweating. Drowsiness. Well, drowsiness is an inevitable consequence of hypoxia and dehydration and so on. Decreased empathy perception. Well, when you feel lousy from all the aforementioned points, it's very difficult to empathize with other people in difficult situations, and that's especially so when you can't interpret their facial expression because they too are wearing a mask. Impaired skin barrier function. Well, I guess the constant contact with the chemical and the abrasive nature of the mask, combined with the accumulation of mask incubated pathogens, which I'll discuss shortly, is bound to cause damage to the protective layers of the skin and their natural antimicrobial secretions, which for some will result in inflammation and infection. So then we begin to see the complex effects of prolonged mask wearing on humans. For some, this may not be noticeable or present a particular problem in the short term, but the long-term consequences are as yet unknown. For many, these effects are noticeable, and some will accept this level of suboptimal health, again unaware of the unwanted or unforeseen consequences. But for some, sadly, the consequences may be severe. The adverse effects highlighted previously may be more subtle and less noticeable in children, at least immediately, but they may be, sadly, more profound in the long term. A developing child's demand for oxygen is, relatively speaking, more necessary and greater than a fully developed adult. The physical and emotional effects of this shameful, perhaps sinful gagging of children are becoming clear and perhaps, but hopefully not, yet to unfold in later years. This ever-present symbol of danger, combined with the prominent and free-floating anxiety that has been present and expressed, sadly, by parents and teachers, will without doubt reflect adversely on the infant psyche. And although not known or studied, there's little question that the non-biodegradable mask fibers and nanoparticles will be inhaled. And although there are mechanisms within the lungs to remove foreign particles, for example, the mucus and the hairs lining the airway, they will help to remove some of these nanofibers and nanoparticles. But it's likely that many will enter the lower lung structures and settle there. And of course, the cells within those structures that normally get rid of foreign particles will be unable to digest the nanoplastics because they're not biodegradable. It's to be hoped that in the future we don't see burgeoning numbers of cases of pneumoconiosis and cancer as a result of mask wearing. Of course, if or when that happens, Johnson, Hancock, Javid and Whitty and co. won't be around to pay for their criminal negligence and coercion. The Kozielinski study emphasises the need for further research, particularly in the gynecological and paediatric fields, as children are a vulnerable group, they say, that would face the most profound consequences of mask use. And they warn of the potential effects of hypoxia on the fetus. The normal effects, of course, are if you starve the mother of oxygen, the fetus is going to be starved of oxygen, and so there's going to be distress. But they warn of the potential effects of hypoxia on fetal developmental pathways, which they say has some potential for promotion of immunosuppression and carcinogenicity. And in addition to all the above, there's the increased risk of infection from the mask itself. While masks provide a dubiously useful element of filtration, there's little robust evidence that they're effective and that the benefits from wearing them outweigh the risks. Conveniently overlooked is the theory that filtration relies on the fact, in part, that microorganisms adhere to the mask material, which can, over time, effectively become a colony ripe for incubation and growth and consequent inhalation and contact, by the way, with an abrased skin surface, abrased from the continual rubbing of the mask. Studies have shown that a considerable number of bacteria, including what are called pathobionts, these are microorganisms that inhibit the body's own natural flora, along with antibiotic-resistant bacteria, accumulate on surgical and even more on cotton face masks after use. Contamination of the mask from the environment, the presence of pathogens within the environment, the so-called virus itself, from filtration mechanisms, from breathing and touching, combined with the warmth and moisture of the mask, provide conditions ripe for the potential incubation and growth of the collected microorganisms. At some point, the collection of these microorganisms could actually dislodge, and the pores of the masks provide portals of access to the airways upon inhalation, especially because of the prolonged and close proximity of the mask to the mouth and the nostrils, and to the skin, by the way. The potential for infection is clear. And all this within a backdrop of poor filtration and all the previously mentioned adverse effects. A 2021 study reported adverse effects of mask wearing on health professionals. Headaches, for example, reported in 245 out of 314 respondents to the survey. Although not necessarily a cause of underlying disease, chronic headache is debilitating, especially for busy doctors and nurses, and this can have a profound effect on their well-being and certainly affect their interactions with patients. And in the case of mask-induced headaches, this is likely to be caused by several of the previously mentioned problems, resulting in triggering of pain-sensitive nerves in the brain structures. For example, the increased heart rate and blood pressure caused by the physical and emotional adverse effects of mask wearing results in brain swelling, albeit minimal, but there is no room or little room for expansion in the brain. So when the blood vessels swell, this applies a consequent pressure on the pain-sensitive structures surrounding the brain, the meninges, or perhaps even the dehydration and bacterial contamination caused by long-term mask wearing might cause or exacerbate sinusitis. Who knows? We accepted this medical intervention without any investigation into the effects on health. Skin breakdown was experienced by 175 health professionals, and acne was reported in 182. That's out of this 314 respondents. Impaired cognition was reported in 81 out of 314 respondents. Reduced oxygen results in reduced energy available for cells. There's no question about that, which results in, to a greater or lesser degree, impaired cellular function. And retention of carbon dioxide results in increased acidity within the body fluids and cells, which again affects cellular function adversely. So it doesn't take too long for these chemical imbalances or abnormalities to affect cognition. Consider it only takes brain cells to be starved of oxygen or optimal levels of oxygen for a short while before they are irreversibly damaged, and you might not even notice this, at least in the short term. But importantly, do you really want to be treated by doctors and nurses with that have impaired cognition? I don't. Now, although there may be an argument for mask wearing in a healthcare situation, where, for example, there's the possibility of ballistic expulsion of infected body fluids, this doesn't really stack up with regard to mandated continuous wearing. I emphasize continuous in non-risk circumstances, particularly in the light of available research with regard to respiratory disease transmission and masks. And also, importantly, very importantly, why should medical professionals have to suffer this continuous discomfort for days, weeks, and years on end, especially when they're already subject to the abuse of excessive working hours without proper breaks and so on? Well, what about the vulnerable and the elderly and the infirmed? A study found that blood pressure and physiological factors related to chemical balance within the body were significantly elevated in patients with lung disease using masks compared to other groups without masks. Another study found that the use of these so-called protective face masks negatively impacted respiratory and skin mechanisms of thermoregulation. That's body temperature control. This can impact on body chemistry, particularly during activity, and cause discomfort and perhaps distress and adverse health effects in the elderly and the infirmed, particularly during hot weather. The British Medical Journal highlighted the risk of falls due to mask wearing, especially in the elderly with ongoing mobility issues. Now, this mask-related phenomenon is likely to go unreported due to the relative propensity for falls in this particular group. That's to say, For example, an elderly person who has fallen did so because elderly people tend to fall. The fact that the mask they were wearing at the time, which impaired their peripheral vision and adversely affected other physiological factors, is overlooked. And this omission is reflected, this omission by science and medical science is reflected in the clear lack of research into this area. So, as I mentioned previously, there are studies that suggest masking is safe and effective, and those are reflected in the unsupported sound bites we hear on the mainstream media. Here, though, I've offered important points for consideration that you won't hear about on the BBC and ITV and in The Guardian and so on, at least not yet. When being told by these people to follow the science, that should start alarm bells ringing, especially in the light of the history of science and medical science with regard to such interventions as thalidomide, safe sedation and sound asleep, free from untoward side effects, or DES, the drug to prevent miscarriage, abortion and premature labor, no side effects, and DDT is good for me, and more recently swine flu, foot and mouth disease, and very recently SSRIs, a drug which for the past 20 years or so has been used to treat depression, and apparently now they are saying it doesn't do that effectively. The list of scientific errors is almost endless. These alarm bells should spur us to do our own research and make our own decisions about such things as prolonged mask wearing. Anyway, there should be sufficient food for thought here in what I've presented to cause us to doubt the popular narrative surrounding masks and to ensure that in the future we don't bully or coerce others into carrying out interventions against their wishes, even if we think it's beneficial. It's important to remember that just because most people think something in a particular way or something is particularly the way we should be behaving, it doesn't make it right, and it's not a reason to follow the herd. Perhaps we should consider the words of the American writer and political commentator Walter Lippmann when he said, "Where all think alike, no one thinks very much."